Hi, I'm Jessica Cook, and for the last 2 years I've been working on a project here at PHII that I'm really excited to talk to you about. As you know, if you're watching this video, communicating about public health informatics is just not easy. It's not well understood and people have different perceptions of it. So, with support from the CDC, PHII worked with the Frameworks Institute to conduct audience assessments and to develop communication tools for the public health workforce. Through early research conducted by Frameworks, we learned early on that public health informatics has trouble making itself visible. We have trouble getting the message through. It's actually a very classic problem. So experts have all the background and the knowledge to communicate well with each other. However, a general audience will have gaps and won't know how to fill in the blanks. They will try to fill in the blanks with what they know, but that can sometimes cause problems. So, for example, you might say that state, local, and territorial health departments need informatics assistance. However, a more general audience, and this could be a leader that you're talking to or even a colleague, might translate that to, yes, we should prioritize upgrading our software and databases. So a general audience draws on what they already know. Their pre-existing knowledge influences how they frame the issue of informatics, and they translate it to technology. In all fields, experts respond to people's misunderstandings by throwing more information at their audience. So we as experts might make more lists, add in some jargon, throw in a little data, hoping that this will lead to some type of epiphany from the audience. However, we know that throwing more information at an audience just doesn't work. Our audience just doesn't have the background and knowledge to fill in important gaps. Instead, a more successful strategy is to proactively frame a topic in a new way to enhance understanding. For this project, Frameworks immediately knew that explanatory metaphors would be really helpful for filling in cognitive gaps. Metaphors are effective because they draw on people's everyday knowledge to help them understand how a new concept works. Frameworks developed 3 metaphors to explain informatics. Frameworks compared informatics to architecture, to translation, and to data logistics. Let's look at them in more detail. First, informatics as architecture. Just as architects plan buildings with the community's needs in mind, informaticians plan data systems that produce the information professionals need to make sound public health decisions. Next, informatics as translation. Public health data come in many languages, and informatics is a translation discipline. Informatics bridges differences in vocabularies that might otherwise inhibit effective communication and the reuse of information. And finally, informatics is data logistics. Just like the complex systems that we depend on to send and receive packages on time, informaticians design the complex systems that ensure people get the public health data packages they need quickly and efficiently. Now, let's look at how you might use one of the metaphors to really define informatics to a broad audience. When a definition is framed with a black box, it means that it was written for experts by experts. So experts will have all the understanding and the knowledge to make sense of it. However, what you can do is you can use a metaphor to connect the definition to concepts that a broader audience already knows. In this example, the architecture metaphor is used to bring tangible concepts into our definition of informatics. Public health informatics is a field that designs the blueprints for the complex data systems that keep information secure, usable, and responsive to public health's needs. Informaticians are like knowledge architects of public health. The information systems they build account for function and local context. And you can intentionally cue the metaphor with certain words. In this example, you'll see blueprints, architects, and builds. So we've introduced 3 metaphors to you, and you may ask, well, which one do I use? And it really depends on your communications goal and your audience. Each metaphor performs slightly different functions. So the architecture metaphor emphasizes system design. The translation metaphor is about understanding your stakeholders' perspectives and needs. And finally, the logistics metaphor emphasizes timeliness and security of data. One last note. The metaphors are not complete definitions by themselves. They're an opening that you can use with a broader audience to begin bridging gaps and developing an understanding. Once your audience has this understanding, you can begin to fill in more detail. We hope that you find the metaphors practical and useful. They are the foundation of the communications toolkit. There you'll find a wide application of the metaphors, including elevator speeches and public health examples. You'll also find the report that details the audience assessments that Frameworks conducted the first year of this project. Visit our website, phii.org/commtoolkit, to begin using the metaphors and crafting your public health informatics messages.